Another common condition we have come through Hope Clinic is skin conditions, because they tend to fall through healthcare a bit depending on what's going on, because the treatment tends to be either topicals to just treat the skin issue, like whether it's a rash or whatever that is that's coming out. It's psoriasis, rash, eczema, it's all just kind of rashes. Most rashes actually come from the inside out. You can have what we call a dermatitis, where it actually is a reaction on the surface of your skin from what you're topically affected by. But most rashes come from the inside out. And Western medicine just doesn't look at it that way much. They do have some medications that will work on the inside. The catch is, they tend to be very toxic. So we get a lot of people coming in for that, and there are a lot of different ways we can help rashes if we can find the causes. So some patients will just have one simple cause and it moves through quickly. A common one is somebody that maybe wasn't nursed by their mom, and then maybe they had and it just caused their immune system to act differently and try to push things out from their intestinal tract through their skin. So that's a relatively simple one. Then we get others where it can be decades in the making of building up what we call liver heat or something like that. It's common sometimes where a woman will get towards starting to get into perimenopause, and then she'll start to get rashes. And that could just be like, oh, well, we have more hormonal heat building and it needs to express some way. And so what we try to do is try to balance that out, clear that heat, and whether, I work on it or somebody in the clinic works on it, or we might refer out to a Chinese medicine specialist to finish that work. There's a lot of things you can do for rashes to actually solve them. The catch is some can take 2 weeks and some can take 2 years.